I'm Ron Gallagher at Maximum Velocity Physical Therapy, and you're listening to HYPERSPEED Radio. You don't have to live in pain, whether you're running, swimming, playing a team sport, or just everyday fitness. We bridge a gap between medicine and strength and conditioning to help you break through at MVPT. What's up, everybody? This is Ron from Maximum Velocity Physical Therapy here in Las Vegas, Nevada with episode 30. Can't believe I've had 30 shows. But so today's show I am calling The Root Cause of Injury. And I'm hoping to keep it around 30 minutes and not make it too super technical. But this is a concept that's been kind of floating around the clinic a lot lately. And Derek and I put together a good outline of what we're going to talk about. I was inspired by this Instagram post. A doctor actually was discussing the lack of nutrition training for medical doctors. And he believes that nutrition is the root cause of disease. And I thought, you know what? I'm the orthopedic version of that. So I am calling this the root cause of injury. And it's also based on a book I read and talks about the theory of 1% of aggregation, basically a cumulative effect of what happens when you improve all the little bits. So what this doctor did with the team in the Tour de France in the 90s, I believe, is improve everything that the team does by at least 1%. And as all the components of the 1% change improved, then the team's overall performance skyrocketed. So they went from not that competitive to ultra competitive just by changing each thing that the team does, like sleep, nutrition, the equipment, training, travel, just analyzed everything and improved everything by at least 1%. And the addition of all those changes actually made a huge impact as the results kind of stacked up on each other. And I'd like to think that my practice at Maximum Velocity kind of does the same thing. Another way to explain it is if you're trying to make a cake and you think of the eggs you use, the flour, the milk, all the components, what if we had the best components? Wouldn't all those components who go into a cake make the cake even better? Well, what if the procedure of how you bake the cake was, resting the dough, resting the batter, I should say. What if every bit of making that cake, you improved all the procedures, and wouldn't that cake taste even better? So essentially, that's what orthopedic-wise is happening at Maximum Velocity. The root cause of injury was kind of a strange choice of words, because we can talk about just impairments in general, physical impairments. So it doesn't necessarily need to be injury. If I said the root cause of pain, that's like a chemical definition of what happens to our body when there's a painful stimulus. So it's really not those things. So we're going to stick with the root cause of injury. And really the problem is why I left a traditional medical system and why I don't accept insurance. In a traditional model, I believe that it's severely broken. And I think that it's really, really hard for patients to actually get better in a traditional setting. And the reason is the clinicians are essentially walking around with what I would call a menu of charges that they can potentially bill your insurance for And that's the only intervention that they will provide. So if you need something that's not on that menu, well, they're not going to get reimbursed for it, so they're probably not going to do it. So clinicians are trained to build treatment programs around this menu, and it's not necessarily in the patient's best interest, it's in the best interest of getting reimbursed. So the insurance is dictating treatment, and the orthopedic surgeons are essentially driving care, because if the person's going to use their insurance, then the insurance is going to require them to get a doctor's referral. So between the handcuffs that the insurance company provides and the orthopedic surgeon provides, it makes it really hard for clinicians in my field to grow. So basically, when I ejected from that system, I was allowed to think freely. I was allowed to do the things that actually help. And over time, the evolution of what I'm doing is actually treating the root cause of the injury and not just treating like a Band-Aid or medicine. What's interesting is if we go all around the medical model, we're going to find signs and symptoms that we're treating, that we're not treating the root cause. And when we even look at something like the diagnostics, like X-rays or MRI, that's actually not getting to the root cause, which is what people would think if they did do some diagnostics, right? So let's say, for example, you have back pain, you go to the doctor refers you for X-rays, and then MRIs. Well, the MRI is just a snapshot in time. It's not actually telling you what's generating symptoms. So just because something is abnormal doesn't mean that it's causing symptoms. So if we make an inference on what is abnormal in your diagnostics, and we try to correlate that with what you're feeling, that correlation is actually very poor. So it makes it really, really hard to explain to the patient that we got a picture of what the problem is, and yet that's not necessarily what is making their back hurt. Because you can have weakness, you can have stiffness, that's not going to show up on the diagnostics. And in fact, if we do find things like arthritis or disc issues, those tend to be more stiffness and weakness related than what is abnormal about the picture. So if you're actually treating the root cause, you would actually be treating the thing that's causing the abnormal picture to show up on the MRI. So if I see degenerative joint disease, or if I see arthritis, those are indicators of stiffness. Because if the joint can't move through normal range, then we're going to wear out mid-range. And mid-range that's been overutilized will look like arthritis or degenerative disc disease on MRI. So the diagnostics can be part of the problem and can add to the confusion on how to treat a patient, because we need to be looking at what's generating symptoms. We need to be looking at the root cause. Orthopedic surgery has made insane advancements, especially in the last 10 or 20 years with technology. And the procedures that surgeons are using are far, far better than they used to be. And there's lots and lots of scrutiny on these guys on how they're doing their job and how they're getting their outcomes. But if we're looking at the root cause of the problem, we might not need as much surgery as we actually need. And that's what the data shows, and that's certainly the experience at Maximum Velocity. In fact, the orthopedic surgeons who used to refer their patients to me for pre-op knee surgery, pre-op shoulder surgery, stopped doing that because their patients were getting better because they didn't need the surgery. So they are operating on people who don't necessarily have all the information on what they need. And I don't think that anybody's doing anything malicious, but I also think that ignorance isn't a good reason to stand behind doing the surgery. Properly stretching, properly strengthening, really good evaluation, finding out biomechanical causes is usually a stronger way to treat these problems than just to rush them off to surgery. There's lots more issues down the road if we have the surgery. So it's really not in the patient's best interest unless the patient doesn't want to do the work. But if you have the surgery, you're going to have to do the work then. So you can either do the work now or you can do the work later. But ultimately, the advancements in orthopedic surgery is definitely not helping us treat the root cause. We need to be asking a little more detailed questions. And as I worked in a traditional setting, I noticed that I was treating patients for problems that could have avoided the surgery because what is symptomatic isn't even what the surgery addressed. So I basically wanted to specialize in preventative medicine. And ultimately, all the people around me told me that there's no money in it, and that's why people don't do it. And I'm trying to change that. I'm trying to prove to the community that there is a better way to do things. And before you go and have something you can't change, let's do the smart rehab first and see if we can prevent it. And preventative medicine literature led me to things like CrossFit, which is kind of crazy because people consider CrossFitters to be injured, but they're actually not. So CrossFit medicine points to barbells and strength training and adequately writing strength and conditioning programs that keep people healthy. And the running literature definitely mirrors that. The old wives' tale that running ruins your knees is absolutely not true. And in the last 5 to 10 years, there's been many studies to show that. And, you know, if those are the same folks that we look at the diagnostics with, we're going to find arthritic changes, we're going to find degenerative joint disease, and they're doing an activity they don't have the tools for, like the adequate range of motion or adequate strength, or in runner's case, efficient running gait. So the running literature definitely points to work capacity as a way of improving runners' ability to be pain-free and run healthy. Orthotics, the literature done on orthotics actually is quite poor and doesn't prove that orthotics actually help. So I've probably trained thousands of people, probably 1,500 people out of their orthotics. And there is absolutely exercises you can do to protect your arch. And the overwhelming majority of the time, it's not even an arch problem. It's probably more of a hip issue anyway, which is the root cause of why this person has chronic foot pain and needs orthotics. Utilizing medicine to change a weakness problem or a stiffness problem is obvious. That wouldn't work. There's lots and lots of research on strength training to show that an adequate strength program is better than a lot of the physical therapy interventions that we do. And basically, it comes down to weakness is the common denominator. The root cause of the problem is usually weakness. And the level of weakness is really the trickiest part of helping somebody get pain-free, because if you don't know the very bottom bare bones exercises to transition to heavier duty things that you would see in a gym, then that transition doesn't happen, and too much too soon hurts as well. So weakness problems that get strength trained too fast or too heavy or too soon definitely can cause some of those symptoms. So at Maximum Velocity, in our attempt to get to the root cause of the problem, it all starts with an evaluation. And your first visit is the most important visit, because we're going to sit and we're going to listen and we're going to build rapport. And just by listening, patients will tell us what their problems are. And if they are bringing a mechanical problem to the clinic, which 98% of people are, which means you're either a chemical problem or a mechanical problem. And a fragile way to treat this problem is to treat it with chemicals, or a chemical way of treating it. That means ultrasound, dry needles, ice, heat. Those are all ways that you can affect an inflammatory response. But the reason why there's an inflammatory response is because of the mechanical nature of the problem, meaning that it doesn't have enough strength, it doesn't have enough range of motion, and the tissue can't tolerate the stress of what you're trying to do, whether that's walking or standing or running or playing tennis. And if you do not treat the problem mechanically, then the tissue will not be able to tolerate the stress necessary. And that is the way that we treat the root cause. We've talked a lot about mechanotransduction, which is the type of treatment that we use at Maximum Velocity, which is a exercise-induced stress that modifies or forces the tissue to adapt to new stress. And once it can tolerate more stress, then the person's going to be able to do more things with less pain. So if we treat things chemically, like ultrasound and dry needles, what we actually know, and this is recent literature, that ultrasound, dry needles, the recovery boots are notorious for removing the stress capability of the tissue in exchange for less swelling or less pain. So unfortunately, the person does experience less swelling and less pain, but the trade-off is the tissue can't tolerate very much stress. So a perfect example is if there's any UFC fans out there, Conor McGregor broke his leg in the middle of a fight, and he was receiving daily cryotherapy or cold treatments because of a change in technique of what they were trying to do with his fighting style. So they were trying to get the inflammation down on his bone, and the more exposures to bone or to cold he got, the less stress capable his bone was. And when he received a stress that he couldn't handle, it actually broke in the middle of a fight. So it's pretty interesting how that population of athletes utilizes tons and tons of modalities that are in that chemical family, and they don't realize it has a negative effect. So if we're talking about specific problems, so let's say you have a history of lower back pain. Well, lower back pain is really, really heavily studied. And the reason is because it is the number one reason in America that a person goes to the doctor. And so if you can imagine the number of people who go to the doctor in a year, it actually makes up about 25% of the gross national product, which is a huge amount of money in America floating through the medical system on the treatment of lower back pain. Doctors have an average of about 4 minutes to triage a patient with lower back pain. And you can imagine that that's not adequate to treat these people. Of all the things that we can use to treat lower back pain, the number one statistically relevant way to treat lower back pain is with general exercise. So physical therapists who are administering exercise programs need to know what specific exercises they need to do to be able to help these patients. And if we treat these problems chemically, then we miss the boat. So of the general exercises that we choose, there are exercises that are better than others, and specifically training the muscles of the lower back is how we can treat people with lower back pain. If you come in for a tendon problem, we will see different versions of how to treat people with a problem like this. We see stretching, we see modalities like the ultrasound and the dry needles, and then we also see adequate loading. And the mechanotransduction is the best way to be able to treat these problems, and that's why we do it that way. So loading a tendon problem actually addresses the root cause much more specifically than, say, dry needles or massage or modalities. Stretching on a tendon will feel good in the very beginning, but in the long term takes away from the tissue's ability to tolerate stress. So if you're trying to run fast, if you're trying to go hard, if you're trying to punch, stretching is one of the worst things we can do to the nervous system to turn it down, and it actually exposes the connective tissue to trouble. So stretching isn't what we want. Modalities isn't what we want, because they both limit the tissue's ability to tolerate stress, while loading is the root cause of the problem, and utilizing progressive loads to be able to teach this tissue how to tolerate stress is how we treat tendons. So if you're looking in on what maximum velocity is doing, and the easy way to describe it is strength training. Well, strength training has a connotation like at a big box gym where they're clanging weights around, although we are clanging weights around, but it's a attention to detail. It's a very load specific intervention to where the person is physically, and it is progressed appropriately, and eventually it has to be heavy. I mean, if we consider running, there has to be between 2 and 7 times your body weight in ground reaction force that you have to be able to tolerate. So if you're not doing anything heavy, then you're not cross-training in a way, you're not treating the problem in a way that teaches the connective tissue to tolerate more stress. So it has to be heavy, but it has to be progressed appropriately to a heavy place. So it's not willy-nilly strength training. It's very specific, it's very scientific, and we build the tissue to be able to tolerate stress. Since Maximum Velocity is a running specialty clinic where we see a tremendous amount of runners and cyclists, triathletes, even the certifications for these sports are not addressing the root cause of athletes' problems. I found it very interesting as a youth and junior certified triathlon coach or a level 1 triathlon coach that the the literature and the facts and figures that they're presenting to their people is actually fairly outdated. And they were teaching more of the stretching, more of the palliative way of treating problems, like the massage and all that stuff, because it is so widely used. That's what people think the standard is, but it's actually not. And having a coach who understands the long-term and short-term implications of all those types of interventions is how we raise really stress-resistant, really, really capable athletes. And we have, many success stories, all the way from track and Olympic level, all the way down to youth sports, on how to utilize proper strength training, mechanotransduction as a treatment strategy, and how to teach these connective tissues to be able to tolerate more and more stress. So to sum it up, while a traditional clinic is utilizing things that make people feel good, it does not address the root cause. And the overwhelming majority of people, probably 99% of people, the issue is actually weakness. When it gets down to brass tacks, it's a weakness problem. And if we address the root cause of all of these injuries, we're actually addressing weakness problems. Knowing how to adequately increase the stress that a person can tolerate through exercise, progressive loading, and eventually get onto some heavy squat, heavy deadlift, heavy push press. That's how we eliminate problems with a tremendous amount of success. And that's why a traditional model is missing and not reaching these success rates. So I always end my show with what I'm listening to. And this week it's been about like 90s and 2000s punk, which is really interesting. And I wouldn't even have described it as punk, but Spotify has been putting these punk lists in front of me, so it's been kind of fun to listen to. So without further ado, make sure that you call Maximum Velocity, get on the website, get onto our socials, and if you want your problem to go away, let's actually treat the root cause. Let's not put a Band-Aid on it and call it good. So with that said, let's get out of here.